Hello, welcome to Abington News and Views. I'm Sean Lee, and today we have with us Dr. Mark Bernard with HealthSource of Abington. Thank you very much, Doctor, for coming to the show today. As a lot of you know, millions of people have a lot of back pain. There are a tremendous amount of back sufferers. So what causes the pain that most people have?
Well, there are a couple of primary causes for back pain. The first being disc-related problems, herniated, bulging, degenerative disc. The second being more joint-related, facet syndromes or misalignments, subluxations.
Now, what is the difference between HealthSource of Abington and other chiropractic clinics?
Good question. HealthSource is a franchise that began in Ohio and has moved across the country. We're now more than 150 clinics in the country. And one of the primary differences that we offer is progressive rehab.
Now, what exactly is progressive rehab?
Progressive rehab is each time you come in, if you are selected for treatment, you'll see the doctor. We'll do whatever structural alignments we need to do. You'll come see our massage therapist, and we work on myofascial or trigger points. And then you'll go upstairs and work with our exercise physiologist, and they'll work on flexibility, strength, and balance.
Now, Doctor, who's typical anybody who, let's say, they're out shoveling snow in the winter or putting in landscaping and have back problems, would HealthSource of Abington be the place for them to stop in to have a quick repair on their back?
That'd be a good start. One of the key things you want to do as soon as you have a problem is get in right away, preferably in the first week before problems become more chronic, and get the appropriate diagnosis and then treatment.
Now, with regard to treatment, one of the machines, I guess it is, that you were talking about with me before we came on the air was the DRX 9000. Now, how does that work?
DRX 9000 is a decompression machine that works on treating herniated, bulging, and degenerative discs in the neck or the low back.
Now, when you say decompress, decompressing the spine?
Decompressing the discs in the spine. The discs make up the cartilage that is between the bones or the vertebra in the spine.
So when you're saying you're decompressing them, what exactly does that mean? Just for anybody watching, because I know I get back pain once in a while, but I don't say I think I need a decompression of my spine.
That's a good point. Decompression is opening up the disc, and you're drawing the disc material back into the center, or opening up the disc in a degenerate disc, which is smaller, opening up that disc space and pumping it up just like a kid would do with their sneakers.
Right.
You're pumping up the disc and bringing water back into the disc and pulling the nuclear material of the disc back into the center, relieving pain.
So then it stays in there, I guess.
After you're finished the treatment, the herniated and bulging discs, the treatment is completed.
Now, there's more than one machine for spinal decompression, and you talked about this one as well, the VAX-D. Now, what's the difference between the two?
One of the primary differences is the positions that you're in during the treatment. The VAX-D is, that treatment has been around quite a bit longer, originally from Canada. The VAX-D, you're laying on your stomach, and so you're holding on to bars over your head with a harness here, and it decompresses the spine laying on your stomach. In the decompression of DRX 9000, you're laying on your back, and the knees are up, and we're a harness, upper harness and lower harness, you're lifting or opening the vertebra in a supine or laying on your back position.
So how long does it take for for the treatment to necessarily start to work, or how long does it take, I should say, to complete the DRX 9000 treatment?
As quickly as someone with a huge herniated disc with pain all the way into the foot, they finished the very first treatment, and he bent over and put his shoes on and tied them. And he hadn't done that in 3 months. So as quickly as first visit, in some cases it takes quite a few longer to start to see more successful treatment. Each treatment that you would come in, you'll be in the office for approximately 45 minutes each time. And most treatment sessions will need between 20 and 30 treatments to complete the treatment sessions, depending on the number of discs and how many levels are involved.
Okay. Now, who qualifies and who wouldn't qualify for the DRX 9000 treatment?
Qualifying for DRX 9000 is based on herniated, bulging, degenerative discs. We identify that through X-rays, MRI, and our exam. People who wouldn't qualify would be people who may have any type of cancer, any type of instability in the spine, or some other type of joint problem that's not related to a disc lesion.
Now, are there any side effects from the DRX treatment?
The only side effects we've seen in our office doing this now for about a year and a half is a little bit of soreness when you finish. And we have the patient lay on another table, and we put some ice on and some electric stimulation, and that's gone by the time they're finished.
Now we're going to take a commercial break, and when we come back I wanted to talk a little bit more, I want to get more into this, such things as spine force and also endermology, which some of the other services that HealthSource of Abington is offering as well. Okay. And we will be right back.
After coming to HealthSource and seeing Dr. Bernard, I feel a lot better. I have no more pain. I can do everyday things easier. And overall, I just feel a lot better.
I come about an hour away to come to HealthSource and Dr. Bernard because I know that I wouldn't get any other treatment at any other location as good as that I'm receiving now.
After I came to see Dr. Bernard at HealthSource, my headaches were completely gone. I did adjustments with him, I did trigger point therapy, and I did spine force to strengthen my back, and I no longer have headaches at all.
Before I came to HealthSource and Dr. Bernard, I was having trouble just doing day-to-day activities such as, washing my face, making my bed, and even standing too long. I would have pins and needles in my back and my neck. And now, after coming here, I'm not having any trouble, and I sleep through the night now.
Up until now, those suffering from back pain had only two basic options. They could live with the pain or take their chances with surgery. The DRX 9000 spinal decompression system is non-surgical, non-invasive, requires no hospital time, and has provided back pain relief for thousands of patients, including many who had all but given up hope. The DRX 9000 spinal decompression system, a back and neck pain treatment that really works.
Welcome back. I'm Sean Lee, and we've been talking with Dr. Mark Bernard with HealthSource of Abington. Before we went to break, I was mentioning that you have other services there as well at HealthSource, not just the DRX 9000 and doing just chiropractic. But one of the questions I have for you too: what is spine force?
Wow, great question. That's an exciting question. Spine force is advanced state-of-the-art rehab. We bought this for using after we do spinal decompression, but we've now incorporated it with all of our chiropractic and progressive rehab patients, that everybody gets the opportunity to use this great technology. It has an oscillating platform, it's computerized, very sensitive sensors that you push or pull, and the patient gets to see with immediate feedback how well they're doing. But the beauty is it's rehabbing all the small muscles of the spine and the core. So very exciting technology.
So you're saying rehabbing, does it also strengthen them at the same time? So, and one of the other services you have too is endermology. Now, what exactly is that? Because you were telling us some fascinating things during the commercial break. Sounds like a great alternative to facelift too in some cases.
Cellulite reduction. Here is cellulite reduction, non-surgical, non-invasive. Surgical reduction, it firms tissues, tightens it up. It's reducing cellulite or the appearance of cellulite. It's decreasing circumferential size so that you actually get smaller going through the treatment. So it can be used by men or women. It's used cosmetically, similar to doing liposuction, plastic surgery, but we don't have the concerns about surgery.
Now you were saying too that somebody came in to have it applied to their face.
We had a male patient come in the other night, and he was asking about one of his eyes was a little droopy than the other, and he wanted to know if we can do anything. So we did a session with him, and you could see a visible difference not only in the eye, but the tone of his skin and even underneath his chin.
So it really tightens it all up.
Tightened it up, firmed it up in just one session. You could see a difference.
So what three things can someone who is suffering from back pain do that would benefit from stopping in or making an appointment with you over at the HealthSource of Abington?
Well, one of the first things you can do is try some bed rest with doing gentle exercise. The exercise would generally be knee to chest. So you're pulling both of your knees gently up to your chest and holding it for a period of time. You can do that single and double. You can also apply ice to your back. Any new injury, we want to use ice for 10 to 20 minutes. You can repeat that every 2 to 3 hours.
Now, is cold better than hot?
Cold is better for hot in a new situation. In an acute situation, we should use only ice for the first 2 days, and then we'll add in some heat before or in the middle of ice before and after.
Right.
So after that, we can use heat after about a week. But the first thing you want to do, or the third thing you want to do then, would be to make sure you call and get an appointment to come in, and let's take a look and determine what the problem is.
Now, what's your favorite success story?
We had an interesting one about 2 weeks ago. I did a special consultation with one of my patients, and she mentioned that her son, who had been a patient of mine, they just had a baby. Well, the baby was born with his chin over on his shoulder. And the interesting thing, now he's 3 months old, his chin is still on his left shoulder. He had never gotten it back up. So we asked him to come in and take a look, and we examined him. He was asleep in the little carrier, and his neck was rotated about 45 degrees over to the right. So we very gently, just using pinky, just very gently brought the neck back into place, and he woke up, and he sat up, and his head came in the middle, and he was hungry. He wanted to be fed, but his mom was screaming because she'd never seen her son with his head in the middle. So that was really exciting. The whole staff was very excited about watching this 3-month-old, for the first time ever, get his head back in the middle.
Making a difference for him.
Very exciting.
Now, what do you think your patients enjoy most about your office?
I think I have probably the greatest staff around. They're warm, they're very professional, very well trained, but they truly care.
Right.
They care about the people who come in, they care about them getting better.
Right, makes a big difference. Now, Mark, if somebody wanted to, how would they reach out to HealthSource of Abington? Where are you guys located, and what's a number that they can call? I'm sure there's people out there right now seeing the show that are suffering tremendously with back pain, because most people I've come across who do have problems with their back, it's usually pretty severe.
Absolutely. We are located right in Abington on Easton Road, 1/2 mile south of the Willow Grove Mall. So you come down, we have a big red and white sign says HealthSource of Abington. You can find us. You can also call us. Phone number is 215-659-7345. And you can also reach us through the internet. Our website is drxworks.com.
There you go. Anybody out there suffering, absolutely get in touch with Dr. Mark Bernard here and get an appointment scheduled and get your back taken care of right away.
Absolutely.
Thank you very much for being with the show, and we will be right back.
After coming to see Dr. Bernard at HealthSource, I feel so much better. At the end of the day, I go home, I don't feel any pain in my back, in my neck, no numbness, no tingling. I feel fantastic.
I really enjoy the staff. The staff is very friendly and they really care about their patients. He has the most up-to-date equipment available on the market, and Dr. Bernard just really is a caring individual. He cares about what his patients' needs are, and I would recommend him to anyone.
Since I've been coming here to HealthSource and Dr. Bernard, it has made a tremendous difference in my well-being and my health.
I was so happy with Dr. Bernard's care that I recommended my family, friends, and coworkers to come see him as well. And I guarantee that if you come to see him, you will not be disappointed.
Up until now, those suffering from back pain had only two basic options. They could live with the pain or take their chances with surgery. The DRX 9000 spinal decompression system is non-surgical, non-invasive, requires no hospital time, and has provided back pain relief for thousands of patients, including many who had all but given up hope. The DRX 9000 spinal decompression system, a back and neck pain treatment that really works.
Is this fun for you?
It's just so different now, and I can't express it enough, but I really can do anything.
This for me was absolutely the answer to what I needed for me in my life.
All the things that I thought I'd forgotten, I can do most of them again now.
I'm thrilled with it. It's the only thing that's ever helped me.
Well, I feel fantastic today.
I'm happy, life's good.
Hello everyone, and welcome to